Hello, I'm April Farrell, founder and executive director of the National Coalition Against Prescription Drug Abuse, also known as NCAPDA. Welcome to this edition of our Lived Experience interview series that aims to educate and inspire viewers to take action to prevent substance use disorder and overdose deaths. Today, we welcome Brian, who is in recovery from an opioid use disorder. Brian's going to share his personal journey with us and his perspective on what action youth and parents can take to avoid becoming a victim of our national opioid epidemic. I also want to welcome him as a new member of NCAPDA's Outreach Director team. I would like to introduce and thank two of NCAPDA's youth interns, Charlie and Annika, for conducting our interview with Brian today. Please continue watching for a minute after this interview is over so we can share some great resources and encourage you to check them out. So with that, I'm going to turn the interview over to you, Charlie and Annika.
All right, thanks so much for the introduction, April. Brian, we're so glad to have you. Thanks so much for agreeing to interview here with us.
Absolutely.
Just to start things off, can you give us some background on the factors that influenced you to begin using prescription opioids?
Yeah, and all drugs for that matter, but as you know, that was my main drug of choice. I think the first thing to cover is that it's a family, it's a history in my genetics. My family has suffered from alcoholism on both sides of my family and drug addiction. I started using marijuana at an early age when I was 14, and I remember the first time I got high, I remember thinking I need to do this every day. It wasn't just kind of like a once in a while thing. It was, this needs to happen every day. When I graduated high school, went off to college, still smoking pot, and you tend to hang out with people that share the same interests. And so that drew me to people that smoked and experimented with cocaine and Xanax and ecstasy and mushrooms and the whole gamut of drugs, which eventually led to opioids, heroin, fentanyl, and kind of what the transition from gateway drugs to harder drugs for me was when I was 24. I had my second hip replacement, and I was prescribed just a lot of narcotics for the pain. And once I had finished those, it was kind of off and running to the races with different substances, most notably opioids.
Mm-hmm.
So you began to use opioids after the doctor prescribed you pills after surgery.
Mm-hmm.
About how long in this did you realize that you were truly hooked, or was it instant?
So that's an interesting question, because by the time I got home 4 days after surgery, all 3 bottles of pills were in my pockets at all times. So you can argue that I was hooked instantly. I definitely enjoyed the feeling when I was in the hospital. I was getting them intravenously, which I would set my alarm to wake up at 2 a.m. to tell the nurses to get my drugs ready. So I think by the time I got home, I knew that this was had an effect on me, and I didn't take it according to the labels. I just took it whenever it was necessary, and if one feels good, two's going to feel that much better. 6 weeks out of surgery, I ran out of my prescription and called to get it filled, and we had some back and forth, me and the nurse, about whether or not I could get it filled. Long story short, I got it filled, but 2 weeks after that, I ran out and actually couldn't get out of bed for the next 2 weeks. So I don't know in that 6 weeks where the physical dependency started. The mental and emotional addiction was instant, but sometime in that 6 weeks, which is still a relatively short time, I became physically dependent on it. So like I said, I couldn't get out of bed when I stopped taking them. I had trouble eating. I had, was going to the bathroom every 10 minutes. So yeah, like I said, emotionally and mentally pretty quick, and then physically somewhere between surgery and 6 weeks out.
How involved would you say were the medical personnel in this entire process?
With the process of prescribing me drugs, talking to me about, I assume this is what you mean with the process of prescribing me drugs.
Yeah, like checking in with you.
They weren't. And I understand that there's a lot of over prescribing going in the US and in the world today. And I'd want viewers to know I'm not completely putting this on the doctor's shoulders, because I certainly had an addictive personality going into the surgery. But there was a written prescription. 6 weeks later, I made the call to them to renew it. They told me, based on the amount of narcotics I was prescribed and the amount of days that I'd passed, I was on a DEA watch list as a result of how quickly I took them, but then was still able to get a refill after that conversation.
Mm.
So again, I had an addictive personality going into this whole situation. And I'm not saying, I had carte blanche with the doctors, but at the same time, they did not check in with me a couple weeks after surgery, and they didn't, I don't recall any conversations that we had about weaning myself off of the pills or be careful how much I take. Again, knowing though that those weren't the greatest thing to be taking as I wanted compared to how the label prescribed.
Gotcha. Yeah, that's terrible. Yeah, the lack of enforcement there.
Yeah.
So you mentioned that you got an MBA while struggling with opioid abuse. How
Yeah.
did using them affect your academic life?
First and foremost, when you're in addiction, your drug of choice, whatever substance it might be or substances, comes first, whether it be school, work, social life. So for me, I wouldn't go to class or start an assignment unless I was high. And that, especially something like opioids or prescription drugs compared to alcohol, you can't just go down to the corner and get that. So it sometimes was a 4 or 5 hour search, and just to do an hour's assignment, read a few chapters and answer some questions. So that, and to answer your question better, that's how I saw it affected my academic life. What others saw, I really don't know. That's kind of why I laughed when you asked me, because I did do well in school and I got good grades, but for all I know, people could have known that I was using and putting up a facade. And I really don't know. I was in the middle of an addiction. So aside from making sure I had my drugs first and foremost, and then the rest of life, to include academics, came after that. I really couldn't say other than that.
Would you say it also affected your social life and relationships?
Yep. So I was in my mid to late 20s during my addiction. And so we'll start with friendships. In 2016, when I first tried to get clean, I called all my friends and family, a lot of my family, and told them, this is what I'm going through. Here's kind of the timeline and how it started and how it got out of control. And everyone was, first thing my father said was, I'm so proud of you. And, first thing my friends said were, we're standing next to you. You got this. We got your back. As a chronic relapser, as someone who's been in and out of 5 treatment centers now, as a chronic relapser, you can only do that with your friends so many times. So by the 12th time I made that call to certain friends, they obviously didn't trust me, and the conversation went a lot differently than whatever you need, you have my support. And a few of those friends, maybe just a couple of them now, but a couple of them, still don't reach out to me, and it's not their fault, because people don't know how to react if they don't know about addiction. But you can only burn those bridges too many times is what I realized. When it came to dating, I, again, was in my mid late 20s, and I would go on a bunch of dates with women, but I would never let them get too close to me. As Annika said, I was going back to school, and I had a good corporate job, and I had this little secret that was just my own, that was addiction, and I couldn't let anyone get that close to me because I didn't want them to find out my secret. Mm-hmm. So socially it affected me in the sense that no long-term relationships with any girlfriends for a number of years, and when I did get in long-term relationships, they caught me lying at almost every day, and it was just not it was a very toxic relationship. And then with my family, not showing up to birthdays or falling asleep on holidays. And, you know, everyone knows something's up and maybe no one wants to talk about it right away, but just not what my family raised me to be. And that was really hard on them, which when you're in addiction makes it kind of a spiral for you. You're disappointing your family, so you want to numb your feelings, so you go back to using even more or continuing to use or whatever the case may be. So yeah, vicious cycle that I went through with relationships and my social life.
I see.
Yep.
So what do you think motivated you to begin your process of quitting?
So what, like they say in Narcotics Anonymous, I was sick and tired of being sick and tired. I was sick of, I remember the night very clearly, actually, when I called my father in 2016. I had waited 3 hours for a drug dealer, and that's all too common. And I'm, you know, I like to think I'm an intelligent guy, and I just couldn't believe I was sitting in a parking lot for 3 hours on this person's time. So that was when I first tried to get clean in 2016. Like I said, I've been to 5 treatment centers, was a chronic relapser. The next time I really tried to get clean, besides trying to quit on a Thursday, taking off work on Friday, and detoxing over the weekend, which I did a number of times, was at the end of 2019 when I got arrested. So unfortunately for me, it took the law getting involved for me to get clean. I went to rehab kind of preemptively during my court case before the judge ordered me to go, so that hopefully the judge would go lighter on me. And I remember coming back from, I was in rehab at the time, they drove me to court. I remember coming back from court to rehab, and the district attorney had held up to their end of the deal, and I wouldn't do any jail time and this, that, and the other. And I kind of had this feeling in my head like I had won. I had manipulated the system once again, because I went to rehab before a judge told me to go, and that allowed the district attorney to make this deal with me. And I really sat and pondered for about 12 hours. It was a Monday, about do I really want to get clean? And do I really want to do this for me? And I did. After about 10 o'clock that night, I realized that I did. And so for me, it was, for my whole, you know, towards the end of my addiction and trying to get clean, it was kind of like tipping over a soda machine. You have to rock it back and forth a few times, or at least I did, before I could get clean, which is unfortunate because it took almost 4 years to do that. And I lost a lot. I won't even begin to list the things and emotions and confidence that I lost over that time, but it was a lot. So yeah, and then when I was in rehab the last time, I saw therapists and nurses who were also in recovery, who were only, you know, a couple years sober and clean, and they looked healthy and they had great jobs and they were good people and they were funny and nice. And that, I wanted what they had, as they say in the program. I wanted that sobriety. I wanted that light in their eyes and that life that they had. And that was a big turnaround for me, is seeing them and being shocked that they were in recovery, and in some cases so recently clean and sober.
Mm-hmm. Well, Brian, it's great that you're seeking a path to getting clean. That's just amazing. But reflecting on, you know, your whole thing with substance abuse disorder, what would you say, what kind of advice would you have for other people in that kind of situation?
Going through addiction?
Yeah.
Whether it be alcoholism or drug addiction, there's a point where you feel helpless, that you are one of the helpless ones, you cannot be saved, and that is not true. I came back from a very dark place, and well, I'll just leave it at that. Another thing that we say in the program is this is the one terminal illness that that there is a cure for. So if you don't treat this, if you don't take the steps to manage this, you will die. But there is a cure for this. And that would be going to meetings, working the steps, whatever the case may be, getting treatment. In most cases, all of the above. That's what worked for me. Yeah, I'll leave it at that.
Well, I think that pretty much wraps things up. Brian, thanks so much for sharing your story. This is truly going to be very educational and inspirational for all the viewers. So thank you so much.
Absolutely. I just want to thank you, Charlie and Annika, for putting these questions together and taking the time to interview me. And thank you, April, for having me.
Yeah, and if you don't mind, I'd like to insert one more question,
Sure.
Brian. So it's kind of a tag on to what Charlie asked. And what would your advice be for parents and youth that, let's just say there's a sports injury, right?
Right.
And so naturally you're going to go to the doctor and you're in front of the doctor, and very commonly they're going to prescribe opioids. So what advice would you have for, that student or, football player or whatever the case is, and their parent who's in front of that doctor, for, a legitimate health problem, a legitimate pain issue,
Yeah, open communications both way between the doctor, the patient, and the parents. I think it's important that the parents show up with certain questions, such as dosage and tapering, if there's going to be a taper off the narcotics, or how long the child will be on the narcotics. And then I think there has to be a regular check-in with the doctor's office with the patient of, how is the pain level, and asking the patient that, and then asking, whether it be parents or other family around the patient, how do you think the pain is? How are you observing it? And then ask, how many narcotics are they taking, and how regularly, and kind of assess it from there. But I believe there needs to be a two-way street of open communication. And then I'll take it one further. The other thing is, when you're an adult and you have surgery like I did, well, a lot of people ask me, what do you think is how could you help me from getting prescribed narcotics? And I would say give those to a loved one who, stops by every 4 hours, or whatever the case may be, a neighbor, someone that you trust that can help give those narcotics to you as prescribed, because you will have times where you have pain, and if you're reaching to your bottle of pills every time you have some pain, that really doesn't end well in my experience. So yeah, having loved ones involved, and making sure everyone's on the same page with, these are the questions we need to ask, these are the things we need to look out for, these are the things we're afraid of, and here's our plan of attack. And then the doctor checking in and providing feedback on a regular basis, once a week, twice a week, maybe.
Yeah, and I would say to definitely assess, is a narcotic even necessary? Even after surgery, you don't always need it,
Sure.
And medication sometimes can do the trick, so.
Sure, and I should have started with that. That my question was assuming that, opioids were needed,
yeah.
Were needed, correct, yes.
Okay, well, thank you so much. A great interview. We really appreciate your input and insight, so.
Yep.
Really
Absolutely, guys.
story. Okay, you take care.
Yeah, thank you. You guys too.
Monica and Charlie too, great job.